Castrating a dog has the potential to bring some really important health benefits, as well as avoid some really nasty and deadly diseases, but it's not for every male dog. And carried out at the wrong time, it can actually increase the risk of injury and different deadly diseases as well. I'm Dr. Alex, I've been a vet since 2006, and in this video I'm busting the dogmatic myth that all male dogs should be castrated at or by 6 months of age, and exposing the data behind both the risks and the benefits for dogs undergoing this surgery, so that by the end of this video you should be clear about the best option for you and your dog, whether you should castrate your dog at all, and also the best age for your dog to have this surgery if it is the right choice. This is certainly not a black and white decision, as some would have you believe. And of course, to make the decision about whether to castrate at all, we really need to think about what the pros and benefits of being castrated are, and also what the potential cons, the side effects, the risks of having this procedure carried out are. I'll start with the benefits, and the first headline benefit of getting your dog castrated is a longer life. So on average, repeated studies have showed that castrated male dogs actually live longer than their entire male counterparts. Figures vary, but one study of 40,000 dogs, so that's a pretty reasonable number, showed that neutered, castrated dogs lived on average 13.8% longer than their entire counterparts. So that's a pretty significant difference. Also, by changing the age of castration from that old-fashioned traditional 6 months that we always used to do, as well as giving actual breed-specific recommendations wherever possible, what we're actually trying to do is maximize this longevity benefit while also reducing the potential side effects and risks of castration. And it could be by doing this, actually, we're going to have the effect of further increasing lifespan of castrated dogs even more. Our next benefit is a reduction in roaming and trauma. So you might think that your dog's going to be a good boy, they're going to stay out of mischief in the safety of your home, in their safe environment. But the fact of the matter is that entire dogs have a significant tendency to roam. And this is why trauma is a significant cause of death in entire dogs. You know, I know personally we often get brought dogs into the clinic that have been found roaming the local streets, and overwhelmingly the majority of them are entire, as is the case for those brought to us having already been hit by a vehicle on the road. You know, the drive to find a female to mate with is high, as is the desire to protect and grow their home territory. And this roaming is primarily a hormonally driven behaviour, because research shows that neutered males, so our castrated males, have up to a 90% reduction in roaming behaviour. That's less fighting with other dogs, less risk of being knocked over on the road or getting into some other form of mischief. Moving on to behaviour next, and reduced aggression and other problem behaviours is the next benefit of castration. So as well as roaming, entire dogs, they can be very protective of their patch. Now this might just be their house, your yard, but it could just as equally mean the dog park or on their usual exercise, their usual walking route. And because of this, aggression, especially towards other male dogs, can be a real issue. Neutering, though, has been shown to bring about a 62% reduction in aggression towards other male dogs. So that's less chance of fighting. That's less chance of injury to both you and to them, and to some other unsuspecting dog, of course. Importantly, though, and this is a real important one when it comes to castrating because of aggression, this aggression reduction is not the case if it's a fear rather than hormonally driven aggressive behaviour. In fact, fear aggression can actually be made worse by castrating. And this really highlights the fact that castration alone should not be thought of as a simple behavioural fix-all solution. That said, if your dog is humping your leg, if they are cocking their leg to pee on everything and anything in sight, then castration really should also put a stop to those. A reduction in prostatic disease is next. So one of the most common Friday afternoon emergencies that I see, and certainly sometimes it feels like I'm seeing this every single Friday afternoon, is the severely constipated male dog that's in urgent need of an enema to be performed either under heavy sedation or anaesthesia. You know, picking poo out of a dog's colon with my finger is certainly not my idea of fun, especially when the cause is very often, most often, preventable. So benign prostatic hyperplasia is a common condition in intact male dogs, particularly as they age. So the older they are, the more likely this is to be the case. So this prostatic hyperplasia is characterized by an enlargement of the prostate gland. And it is this large prostate which effectively narrows the colon and at times can make it really difficult, if not impossible, for a dog to poop. Diet has a role here, and often I'm seeing it in working dogs. I'm practicing rurally, and we see a lot of working dogs that are fed a mixture of bones and poor quality foods, and that just really binds them up and causes significant problems and increases the risk of them needing an enema. But as well as problem pooping, this large prostate also increases the risk of prostatic infections, of prostatitis, and it can also cause problems with a dog's waterworks as well. So testosterone is the primary driver of these prostate issues. Neutering effectively eliminates this risk. Importantly though, neutering does not reduce the risk of prostatic cancer. In fact, the risk may be slightly increased, although thankfully this type of cancer is pretty rare. Sticking with the back end, so prostate and back end issues go hand in hand. There are several more conditions that entire male dogs are at a greater risk of. We've got things like perianal adenomas and anal gland adenocarcinomas. They're two growths that are more likely in entire male dogs compared to their neutered counterparts. The former, so the perianal adenoma, it's a benign growth, so it's not a nasty growth, but it does frequently need to be removed just because of its location. It's not going to spread to other parts of the body by and large. The same, unfortunately, can't be said for the anal sac adenocarcinoma. So this is a really nasty, malignant tumour that's often spread by the time it's first detected. It's not a common tumour, but it is nasty, it is aggressive, and it is frequently a fatal one. Another back-end issue is something called perineal hernia. So perineal hernia is a breakdown of the pelvic floor in a male dog, effectively. That allows the abdominal contents, so the bladder or the intestines, to pass through the pelvis and form a swelling on a dog's back end. It also causes the rectum to develop a pouch that fills with stool, and yeah, you guessed it, this is another reason why entire male dogs can become constipated. It's a disease that is significantly more common in entire males, and while it's still not overly common, the surgery required to repair this hernia is complex, it's expensive, and without this surgery it can often end up being a fatal condition as well. And there are still more benefits to castrating a male dog. So testicular tumours, well, no testicles, no risk of testicular tumours. It's simple. These tumours, they account for about 7 to 10% of all tumours diagnosed in entire male dogs, an average age of diagnosis of 10 years. So this is tumours, unsurprisingly, in older dogs. Thankfully, with testicular tumours, 8 out of 10, so 80% are benign. They don't spread, but they still do require a bigger surgery, something known as a scrotal ablation, to successfully remove the testicle and remove all signs of cancer, all evidence of cancer in the body. And these risk stats are also for dogs with normal descended testicles in their scrotum. For what we call cryptorchid dogs, and that's where one or both testicles actually fail to descend into the scrotum, the risk of testicular cancer is actually 10 times higher. And the risk of these being a nasty malignant tumour is also significantly higher. And it's because of this, really, cryptorchid dogs should always be castrated. The next benefit is a reduction in certain infectious diseases. So roaming, breeding, fighting, that increases the risk of several infectious diseases. These are going to vary depending on where you are in the world, but they include conditions such as brucella or transmissible venereal tumour. You know, your vet can discuss the risk of these so that you can get a true local picture, because they, depending where you are, it may be that these aren't a factor at all and nothing to worry about. It may, though, be that they are very common. And then the final benefit of castration is to prevent the euthanasia of stray and unwanted dogs. So this is a benefit to the whole population rather than the specific individual. So every year there are millions and millions of dogs that are killed in shelters across the world because they are unable to find new homes. You know, all the time I'm hoping the situation will change, but just the other day I read an article locally, one of the local cities in the South Island of New Zealand are being inundated with puppies and they're having to euthanize them because they simply can't manage all of them being surrendered to rehome them and all the costs involved. It's really not a situation anyone wants to be in. And while your male dog won't give birth and you won't be responsible for raising the puppies or rehoming them, it takes two to tango. So can you honestly guarantee that your dog will never sire puppies? Or if they do, that none of these puppies will end up being part of this terrible situation? So those are the benefits of castrating your male dog, but let's switch tack now to talk about the risks of castrating male dogs. So over the last decade or so, we've started to understand that there are more risks than were previously thought. And with this realization has actually come more confusion, and it's made it more difficult to actually make the best decision for each individual dog. I say best in inverted commas because there isn't always a right or a wrong answer. You know, we all love to make generalizations. It just makes life simpler. And the temptation is that when some new research is published, we apply these new findings to every single dog. With castration timing, however, as you'll see, the message is really mixed, and what's true for one breed may be completely the opposite for another, even closely related breed. Castration risks are also going to vary significantly depending on the age at which the surgery is carried out. And this is where really breed-specific recommendations come in to balance these risks with the benefits related to the timing of castration. And I actually use a table and guidelines that I've left for you linked down in the description. So you can get that, you can look up your dog's breed and see which is potentially best for you after understanding all of the benefits and risks. Now, these are still only recommendations for timing of castration if you decide that castration is the right thing for your dog, because whether the risks, the downsides outweigh the benefits, well, that is up to you. But something that I discuss in more detail after diving into these possible castration risks. So the first risk, and perhaps most obvious, is actually the surgical risk, the risk with the surgery and anesthetic itself, because any surgery, any anesthetic does inherently carry some degree of risk. Castrating a male dog, it is a routine surgery. It carries less risk than spaying a female dog. It is simpler, but it still may be the biggest procedure that your pet undergoes in their life. And for certain breeds, here I'm thinking maybe our brachycephalics, our squash-nosed dog breeds, the risks may actually be higher than other breeds. As for complication rate, well, that's reported to be anywhere from about 3 to 33% of castration procedures, but the majority of these complications are minor, and we probably wouldn't even think of them as such. A little bit of tenderness or bruising being the most common, and they require no specific treatment. At the other end of the spectrum, though, death rates are less than 0.01%, so that's 1 in 10,000. And there are also steps that you can take to reduce your dog's anesthetic risk, which I've discussed in other videos. Complication rate and risk, it really is something that does vary from clinic to clinic. And given the nature of any anesthetic, of any surgery, it's really not something where you want to make the decision based on cost alone. The next big risk, this is very common, and I doubt it will be a surprise to you, is to hear that neutered dogs have a tendency to gain weight and become obese as a result. This is a serious problem that has significant ongoing health implications, and it's crucial that we recognize that once a dog is castrated, their energy requirements drop by about 15%. And it's really important that exercise is optimized to maintain muscle. So putting in a few weight management strategies at the time of castration and making sure that you're feeding the right amount goes a huge way towards preventing or correcting obesity and its associated problems. And these are steps that every owner who chooses to castrate their dog should implement. The next risk of castration is cranial cruciate ligament disease, or cruciate ligament disease. You might know this as the ACL, the anterior cruciate ligament in people. It's the most common ligament injury in dogs. It affects up to 9%, sometimes more, of individuals of at-risk breeds, and larger dog breeds are generally at a greater risk. So, as I say, this is the same injury in dogs as an ACL rupture in humans. And the cruciate ligament, it runs within the knee, and it can either fray, which we call a partial rupture, or it can completely rupture and break and the joint be horrendously unstable. And regardless, this damage results in pain. It results in some degree of instability within the joint, and treatment generally involves surgery to ensure the best long-term result. Now, This surgery is quite involved, it's not cheap. And so while the condition is correctable to a certain degree, and I say a certain degree because there's always going to be some element of arthritis down the track, no matter what's done, this is definitely a condition that we want to prevent from happening if at all possible. So then when does castration increase the risk of this cruciate damage? Well, the answer to this is that the risk really depends on dog breed. Overall, the trend is that for small breed dogs, castration doesn't affect cruciate ligament disease risk at all. These are dog breeds that really aren't at risk of this condition happening in the first place. For larger dog breeds though, castration before reaching skeletal maturity, so that's 12 months or later for our very large or giant breeds, that appears to increase the risk of cruciate ligament injury in certain breeds, but it doesn't increase it in others. So this is where that generalization can be really difficult. But this breed-specific cruciate risk has been combined with the risk of other joint issues and certain cancers, which I'm going to come on to in a little bit, to give very specific recommendations about the best timing for castration for 35 different dog breeds. And again, that table, those recommendations are linked in the description down below. So cruciate ligament is one joint issue, but there are other problems. So the development of abnormal joints in the form primarily of hip and elbow dysplasia, so abnormally formed joints, is the next castration risk to consider. So abnormal joints again lead to the early onset of arthritis, and so a lifetime of pain management, assuming that we're recognizing it in the first place. If we're not, then it leads to a lifetime of pain. Again, with regards risks of castration, we really have mixed messages depending on breed. So examples in German Shepherds, which are a breed which suffers from a lot of joint disorders, actually being castrated before 2 years of age, and especially before 1 year of age, significantly increases the risk of at least one of these conditions. Golden Retrievers are the same if castrated before 12 months, but Labradors have no change in risk regardless of castration timing. So this really highlights that we've got different risks for different breeds, even closely related breeds. Cancer is next on our list of potential castration risks. So this is the headline risk that many people will quote and talk about when advising against castration. Don't do it because your dog will get cancer and die. But is this really true? Well, we've already seen that cancer actually reduces the risk of testicular and anal sac cancers, and we've also seen how neutering on average leads to a longer life. Some of the breeds where there appears to be an increased risk from some of the more common cancers, so here we're thinking things like lymphoma, hemangiosarcoma, osteosarcoma, and mast cell tumour. These breeds with the increased risk include the Boxer, the Golden Retriever, the Border Collie, and the Boston Terrier. With these, delaying castration, however, typically means that any increase in cancer risk is eliminated. I should also say that this is breeds where cancer risk appears to be increased. And that's because as is very often the case with our veterinary studies, unfortunately, we're dealing with relatively few studies, and each of those studies is composed of actually a relatively small number of individuals. Add into the fact that studies often don't agree with each other, and the end result is that actually firm conclusions are hard to make. So a real clear example of this is the incidence of a nasty bone tumor, osteosarcoma, in Rottweilers. So I can show you one study where there was no significant change in risk with castration at any age for this breed when compared to the risk for entire male dogs. I can also show you another study that shows the risk jumps from about a 1 in 10 risk to a 1 in 4 risk for Rottweilers castrated before 1 year of age. So this is two different studies with wildly different results. For me in Rottweilers, well, this one point alone would make me actually want to wait until they are at least 1 year old before being neutered. But then I also know of another study that shows that neutering at any age younger than 4.5 years in Rottweilers has an adverse effect on life expectancy. This is for this breed specifically. So then what to make of cancer risk? Well, in other studies that have looked at the general pet population as a whole rather than specific breeds, there's again been shown to be an increase in various different cancers in neutered compared to entire individuals. So this means that the risk is likely real, but given the fact that there is so much differing evidence out there, firm conclusions are difficult to come by. And the other question to ask is, well, what exactly does this increased risk mean? Does it mean that instead of a a 1 in 1,000 chance, there is now a 1 in 900 chance? Or rather, as is the potential for osteosarcoma in our Rottweilers, does it mean that there is now a 1 in 4 chance instead of a 1 in 10 chance? Clearly, this one is incredibly important, but the former may not be too much of an issue when compared against the known benefits of castration. It may even be that neutering at specific cages actually reduces the risk of cancers, where the risk is increased if that timing is different. There is some data to support this theory, but in most cases, we just don't know for sure the true answer to this question. It is, however, considering the risks of the development of these more common cancers, as well as the joint diseases, which are also common, that has led to the breed-specific recommendations linked in that description down below. And I guess really if there's any doubt, we really should err on the side of caution, because these are significant conditions for the dogs that then go on to develop them. There are other risks with castration. So we have an increase in anxiety and fear aggression. So castration has been shown to increase the risk of fear-related behaviors. So that includes fear of sudden or loud noises, unfamiliar situations, and separation anxiety as some examples. This increase in general fear and anxiety can also lead to an increase in aggression towards unfamiliar people or dogs, especially, but in severe fear states, that aggression can be targeted towards people or animals that dog is actually familiar with. And again, it's for this reason where care needs to be taken when neutering an aggressive dog as the fix, because if it's fear-driven, we're actually going to make that situation worse. Importantly, the effects of castration on fear and aggression behaviors become less as a dog ages. Another reason to delay castration, especially if a dog is already showing signs of fear or anxiety at a young age. Also another reason to focus on proper socialization in young dogs. And then we've got immune system breakdown. So our last set of conditions to look at are autoimmune conditions. So these are caused by the breakdown and function of the normal immune system, with the result being several different diseases. And basically the immune system attacks different parts of the normal body. So the evidence of a link to castration is mixed, and while it may indeed play a role, these conditions, they are really generally poorly understood and felt to be influenced by many different factors, of which neutering is just one. And in fact, our genetic and environmental factors have been implicated as the driving force in many. It should also be pointed out that by and large, while there is an increased risk, these are still relatively unusual conditions, although clearly significant to those dogs that go on to be affected by them. So those are our benefits and those are our risks of castration. Are you still thoroughly confused? Well, if so, to be honest, I'm not surprised, because from all the data out there, it really is impossible to make any sweeping generalizations. Simple one-size-fits-all rules, they're so much more appealing, they're far easier to communicate, and they're far easier to apply than subtle, complicated decisions based on various risks that are, in all honesty, not fully understood. If there is one thing that should be clear, though, it's that what's right for one individual may be wrong for another, because of the breed that you have, because of your lifestyle, because of where you live, or because of the different risks that people are simply comfortable living with. And this means that you shouldn't feel under pressure to make the right decision, because there is simply no such thing. That said, I have my view on the subject, and it would be a bit of a cop-out just to leave you here, present the data, and leave you hanging without giving you my take on things. Hopefully, though, you can see the thinking behind my recommendations. And to be honest, so long as you've considered all the pros, you've considered the cons, I'm very happy for you to come to different conclusions based on you and your dog's unique situation. So here it is. I believe that the vast, vast majority of dogs will benefit from being castrated at some point in their life. My preference would be that where there is specific breed guidance, this should be considered as the minimum age of castration. I use the guidelines that I've prepared and linked in that description down below. For breeds that are not included, I would consider the following to be, again, the minimum age of castration. For small breed dogs with an adult weight of less than about 15 kilos should be neutered no earlier than 6 months of age. Large breed dogs should be neutered no earlier than 12 months of age. Here we're waiting for skeletal maturity. And giant breed dogs should be neutered no earlier than 18 months of age, because it takes them longer to grow. If possible, though, I would prefer to leave male dogs entire for longer, instead castrating from about 2 to 3 years of age. So unlike female dogs, there's no real compelling health reasons for castrating at the minimum ages as opposed to leaving it that little bit later. That being said, I would castrate earlier, so at the minimum age, or even younger, based on discussion in some situations. So these are where there is a risk of roaming or your dog has already proven to be an escape artist. So a potential increase in cancer risk and joint risk is really offset here by the risk of being run over or developing a potentially fatal infectious disease. Now that infectious disease risk is going to be local, but cars, vehicles are everywhere, and we get too many dogs being hit on the road. Another exception would be if they are living with or close to an entire female dog and puppies are not actively being planned for. The next exception would be where there is a problem with confirmed hormonally driven behaviors that aren't fear related. The caveat here also being that castration isn't a fix-all, and for serious behavioral problems, a behaviorist should really also be consulted. At the end of the day, though, it's all about maximizing the benefits and minimizing the risks. But one of the main risks that a lot of people are concerned about is actually the risk of anesthetic and surgery in the first case. And to find out exactly what those risks are and how to prevent them, you should check out this video linked on screen. So tap on that video, I'll see you there. But until then, I'm veterinarian Dr. Alex. This is Our Pets Health, because they're family.